And the heroin epidemic continues to grow in our region. Addiction specialists say it's spreading to suburban areas, no longer isolated to the inner city. Now a drug that's been used for more than a decade to treat the addiction is growing in demand. News 4's Callan Gray looked into why more people want to use Suboxone. Callan?
Melina, a Buffalo man addicted to heroin says he turned to it as a last resort and it saved his life. But physicians tell News 4 there's a shortage in the number of people who can prescribe it.
It's been 8 months since Jose decided to turn his life around.
In a sense, doing drugs is like being suicidal. I had to make a decision. It was either I wasn't going to make it or I was going to make it.
Jose hit rock bottom, addicted to painkillers and then heroin. He wanted to tell his story of recovery, but asked we protect his identity. He tells us he had it all, a good job, a family, until he was injured on the job and handed a prescription for painkillers.
Felt like I was having problems. And when I bring it to the doctor's attention, they said it wasn't possible. It was impossible to become addicted when you're prescribed. And
he refused medical treatment, but ended up buying the pills and then heroin on the street. It's a common pattern. A 2013 study by the Substance Abuse and Mental Health Services Administration shows nearly 80% of first-time heroin users previously used prescription painkillers. Jose told us heroin was cheaper and more accessible than pills.
So you realize if you kept doing this?
Oh, I would have died. Most definitely. I'm surprised I didn't.
He started buprenorphine treatment. The drug has been widely used since early 2000s, but now it's growing in demand. It's an opioid taken as a film or a pill that prevents withdrawal symptoms. At Lakeshore Behavioral Health, a patient has to be in withdrawal before they can start using buprenorphine. Dosage is based on how well the drug curbs those symptoms.
Generally, by the time people make it to this stage of treatment, they've been using opiates for an extended period of time, and it's caused wide-ranging negative effects in their lives.
Dr. Jared Mashi prescribes buprenorphine and says it's used as a last resort. He told News 4 it's growing in demand because more popular treatments like methadone now have wait lists. And people are starting to prefer buprenorphine because you can get it at a pharmacy instead of going to a clinic to take it. To prescribe buprenorphine in New York State, you have to be a licensed physician and complete a course.
The main difficulty now is actually that there's not enough people, not enough providers available to prescribe it.
There are 80 prescribers in Western New York, including 27 in Buffalo, 13 in Amherst, and 11 in Williamsville. But each physician can only treat up to 100 patients by law. Mashi hopes more doctors will become prescribers. But he says, like with any drug, there are risks to this treatment.
Because it is an opiate, if you were to relapse and mix with other drugs, particularly things like Xanax, Valium, Klonopin, as well as alcohol, it is possible for there to be a mixed overdose.
And it can be addictive, so patients have to be tapered off the drug. But for some patients like Jose, it's worth the risks. He says it saved his life and will help others.
And if they really want to do this, they can make it through this program.
Dr. Mashi told us the growing demand and lack of prescribers is creating a black market where people are buying it on the street to detox from heroin. We talked to the Erie County Sheriff's Office, who told us it is out there, but not anywhere close to the level of heroin or prescription drugs. Reporting live, Callan Gray, News 4.